Hello, my name is Dr. Inderpal Randhawa. I'm the founder and chief medical officer of the Translational Pulmonary and Immunology Research Center. Starting in February of this year, all the way to May of this year, I did my very best to look at the pandemic and utilize a data approach towards clinical research and demographic population information, and tried to present weekly information videos to this community all the way until I felt we were in a better position. I hope that those series of videos were helpful. 6 months ago was my very last video, and that video actually projected well into 2021 how this pandemic would play out, particularly in this country. I encourage you to go back to that video and look at how those projections played out. And keep in mind that those projections looked at two primary factors. They looked at hospitalization rates and they looked at COVID fatality rates. What did it not look at? It did not look at case positivity, and it did not look at total number of cases. Why is it important to understand that those data points are not incredibly important in this current pandemic? It's very simple. The current pandemic is in a situation where if you only look at case positivity or case positive rates, then you are looking at a tremendous amount of bias. That bias is played threefold. Number one, if you have a very large population, if you're in a very large populated city, for example, you're going to have a higher number of case positives at any given time. Number two, areas which have had recent increases in case positives will actually have splayed data, so you can actually see a bias towards less total number of positive cases. And number three, the government mitigation rules are highly variable in this country. We're seeing some states with very strict mitigation measures and some states with not so strict mitigation measures. The general conclusion is this country since day one has decided not to put this entire pandemic under complete control. Therefore, our best bet is not to look at case positivity, but to actually look at hospitalization rates and total COVID fatality rates over time. I would refer everyone who's interested in learning more about COVID to go to covid.cdc.gov and look at their heat map. Unlike the current media, who only projects total number of case positivity, here you can actually see that the majority of current COVID cases in the last 7 days per 100,000 population is central in the middle of the country. It is really the middle northwest to the western part of the U.S. that is seeing an uptick of coronavirus, which has simply not been present before. And indeed, these are areas of the country who have never had a primary surge. At the same time, if you look at other parts of the country where they have already had a primary surge in May, June, and July, the total number of case rates per 100,000 has significantly reduced, and that is seen as a very light blue or light green color. When we change the actual time period to the beginning of the pandemic, what you also notice now is that the same areas that are currently being hit with this initial phase or this initial wave in the middle of the country also have the same total rate of positive cases per 100,000 people. And what this tells you is mitigation measures per state actually predict the number of total cases that will occur in 7-day periods of time. If you look at the total number of cases since the beginning of the pandemic, you can clearly see the population effect. California with a population of 40 million, Texas with a population of 30 million, Florida with a population of 20 million, Illinois with a population of 12 to 13 million, all have the highest total number of cases since the beginning of the pandemic. But if you look at their current caseload now, it is significantly reduced because they've gone through that first wave of coronavirus cases. Going back to the first map, which is the current state of affairs with coronavirus in this country, I would strongly recommend utilizing this data as your primary source to make decisions. This data shows you that the current level of risk is in the central portions of the country. This is their first legitimate wave of this disease. And if you pay particular attention, the areas that had their primary wave in March, April, and May are all doing relatively well. And this is the up and down cycle you will see for the next year after vaccinations are deployed well until the end of 2021. And you can use this type of map as a resource to determine what types of activities you and your family will proceed with. If the Southern California Food Allergy Institute and TPERC were represented on this map, it would be represented in Southern California as white. The reason it would be white is because in the last 8 months, with over 50,000 foot traffic persons walking through our facilities, we have had 0 transmissions to anyone else. And it shows you that great technology, testing, tracking, and efficient software processes can actually create COVID-free zones. So 6 months since my last video, I would say that the state of COVID in the country is improved. We have seen dramatic improvement in ICU fatality rates, sometimes dropping by as much as 40 to 60%. That is absolutely remarkable. The increased amount of testing, the increased amount of early testing has completely been a game changer. I can tell you as somebody who works at many hospitals that we've seen a combination of factors significantly reduce the number of inpatient hospitalizations, the number of inpatient ICU stays, and the total amount of fatal risk that has occurred across all age groups. This is very important information to take away. Vaccine technology has been absolutely amazing, and actual vaccine deployment is imminent. But in the end, remember this, that progress only works when we all work together, when systems work together. So personal behavior, personal mitigation is key. We also want to understand that technology, testing, and software, when it's all brought well together, that is a place where we can create COVID-free zones. We've done that here at SoCal Food Allergy, where over the last 9 months, we've been in a position with over 50,000 foot traffic people coming through our systems that we've never had a single spread of COVID in this institution, period. That is absolutely remarkable. Stay tuned for our December 1st Food Freedom virtual event. I will spend a significant amount of time during that conference to talk about COVID. I want to speak specifically about the details around high-risk groups, particularly kids with food allergies. What is important to know when it comes to food allergies and COVID? I will also go into details on vaccine development and vaccine safety, and I want to spend a specific amount of time on where this COVID pandemic is going in the next 6 months on treatment. That is a very key concept. We want to look at the landscape of treatment over the next 12 months because that, in combination with vaccine therapy, is going to take us to the other side of this entire event. Look forward to talking to you then.